Erythromycin ointment is used to treat certain eye infections, such as conjunctivitis, and to prevent certain eye infections in newborns. It belongs to a class of drugs known as macrolide antibiotics and works by stopping the growth of bacteria. This medication treats only bacterial eye infections and will not work for other types of eye infections. It's important to use it as directed to avoid decreased effectiveness. The recommended daily dosage and optimal timing should be determined by your healthcare provider. When applying erythromycin ointment to your eyes, make sure to wash your hands thoroughly first to prevent contamination. Be careful not to touch the tip of the tube or let it touch your eye, eyelid, or any other surface. Only use the ointment for your eyes and do not swallow it or inject it. If you wear contact lenses, do not use them while using this medication. Sterilize your contact lenses according to the manufacturer's directions and consult with your doctor before using them again. To apply the ointment, tilt your head back, look up, and gently pull down your lower eyelid to create a pouch. Then, as directed by your doctor, place about a half-inch strip of ointment into the pouch. Close your eye gently and roll your eyeball in all directions to spread the medication. Try not to blink or rub your eye. Repeat these steps for your other eye if necessary. Wait a few minutes for your vision to clear before driving or operating machinery. The dosage of erythromycin ointment is based on your medical condition and response to treatment. Do not increase your dose or use it more often than directed. If you are using other eye medications, such as drops or ointments, wait at least 5 minutes before applying other medications. Use eye drops before eye ointments to allow the drops to enter the eye. Use this medication regularly at the same times each day to get the most benefit from it. Continue to use it for the full time prescribed, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. If your condition lasts or gets worse, be sure to inform your doctor. If you experience eye stinging, burning, redness, or temporary blurred vision, it's important to let your doctor or pharmacist know. This medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. Using this medication for extended or repeated periods may lead to other types of eye infections, including fungal infections. If you notice new or worsening eye symptoms such as pain, swelling, thick discharge, or pus, stop using the medication and contact your doctor. While a severe allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. Before using erythromycin ointment, it's important to let your doctor know if you have any allergies to erythromycin or other similar antibiotics. This ointment may contain ingredients that can cause allergic reactions, so it's best to talk to your pharmacist about any concerns. Make sure to inform your doctor or pharmacist about your medical history before using this medication. After applying the ointment, you may experience temporary blurred vision, so it's important to avoid activities that require clear vision, such as driving or using machinery, until your vision is clear again. If you have upcoming surgery, it's crucial to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, you should only use this medication if it is clearly needed. It's important to discuss the risks and benefits with your doctor before using the ointment. If you are breastfeeding, consult your doctor before using erythromycin ointment, as it is unclear whether the medication passes into breast milk and if it could potentially harm your nursing infant. When using erythromycin ointment, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. You should never start, stop, or change the dosage of any medicines without first consulting your doctor. This will help ensure the safe and effective use of erythromycin ointment. If this medication is swallowed, it can be harmful. If someone has taken too much and has severe symptoms such as passing out or difficulty breathing, call 911. Otherwise, contact a poison control center immediately. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share this medication with others, as it has been prescribed specifically for your current condition. Do not save it to use for another infection unless specifically instructed by your doctor. If you forget to use a dose, use it as soon as you remember, but if it's almost time for your next dose, then skip the missed dose. Just use your next dose at the regular time. Don't take a double dose to make up for the missed one. When using erythromycin ointment, it is important to store it at room temperature and avoid exposing it to high heat or freezing. Keep all medications out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.